Thank you so much, Zaki. Yes, change is indeed possible, and that's what we are expecting. All right. The program is still Good Morning Abuja. Okay. Now we have a guest in the house, another doctor this time. Okay. I want to talk about hepatitis prevention and treatment. All right, please join me as I welcome Dr. Agbohime Gifts. I hope I didn't more that.
No, it's fine.
I tried.
Morning.
Okay. Thank you so much for joining us.
Thank you for having me.
Wow. Hepatitis.
Yes.
Is it deadly? Is it a deadly disease? A lot of people, when they hear it, they say, oh, I've heard someone say, that sickness is a deadly one. So for you, is it a deadly disease?
Yes.
Okay.
Very deadly, with little knowledge and very small understanding.
Okay.
Hepatitis is a one-of-a-kind disease. The way we talk about HIV and we speak about it, I think we should also talk about hepatitis with that same intensity. You know, HIV weakens you, hepatitis kills you.
Wow. That's a serious one.
Yeah.
Okay, so let's begin to look at the different types. We have different types of hepatitis.
We do, actually. We have, right now, categorically, that affect human beings. We have 5 types, A, B, C, D, E. And
A, B, C, D, E.
Yeah.
Okay.
And strangely enough, A and E, we get infected from the mouth. Things we touch, things we eat, poorly washed vegetables, defecation in public places.
Wow.
That's where we actually contract those. While C and B are contracted via blood, substance, human semen, so sexually transmitted infections, mother-to-child transmissions, needles, infected needles, pains. Those house are people that clip nails and all that.
Okay.
That's B and C. While D is a very interesting virus. Most of the time, D comes with B.
So D comes with B?
Yeah.
Okay.
We notice that people who have B are the ones who have D. So those are the 5 types, and those are the 5 ways, or the 2 major ways that you can get these 5 types in that broad category.
Okay, let's look at the various ways of prevention.
Yeah.
Prevention, yes. Let's look at the ways of prevention, especially preventing the infection.
Yes.
Spreading out.
Yes. So on Sunday, which was the 29th of July, I believe, that's the World Hepatitis Day. And, it was actually captioned, "It is time to take action." Yeah. So, and one of the things we pushed out on that day was the prevention of hepatitis B and C. Hepatitis is what we say, on a broad spectrum, is the inflammation of the liver. Yeah. And it can be caused by alcohol, can be caused by, the viruses I mentioned. It can be caused by fungi, can be caused by bacteria. But the 2 principal causes are B and C, which are the most common causes of hepatitis. Even in Nigeria, statistics show that we have about 11.1%, between 8 to 12% of the average population is living with hepatitis B, and about 2 to 3% is living with hepatitis C. And only about 0.6% are tested in Nigeria for B, and less than 0.1 for C in Nigeria. So when it comes to prevention, 1, testing, screening, know your status is important. Use protection sexually. Use protection.
It's also sexually transmitted?
Yes, like I said, B is sexually transmitted. The use of condoms is necessary. Telling your partner what your status is necessary. Also, blood screenings. Transmission of hepatitis C, usually we notice if blood is not properly screened during blood transfusions, can be transmitted from one person to another. So screening of blood when transfusing is very, very, very important for the person. Also, mother to child. Women must know their status because it can be given to their babies at the early stage. Statistics show that only 45% of children born are given vaccines in Nigeria, which is less than the world average, coming to about 85%. So we need to also screen mothers at the antenatal clinic so that they can be aware. And if they are positive, they can give their babies the first vaccine and also give antibodies against these viruses to their babies. Surveillance. The nation must come together as a body and have a surveillance in order to have proper statistics and analysis. Are we beating the virus?
Or is the virus beating
us?
It will never beat us.
Yes.
We'll
So
beat
we
the
have to have
virus.
proper surveillance.
Wow.
You know, if you go to the NCDC platform, you will see surveillance about HIV. You will see surveillance about the current cholera outbreak. You will see surveillance about Lassa fever. You will see surveillance about Ebola. You will see surveillance about TB. But it's very hard
For you to see surveillance
about hepatitis.
Hepatitis.
So we need to have the data on what is going on around us about hepatitis B. And if positive, you know, you need to go for testing and follow up. Meet your doctor. Yes, it is a deadly disease, but it is not a death sentence.
Wow, I like that. It's not a death sentence.
It is not.
That one is consolation.
It is not.
Okay, let's look at the stages of treatment.
Yes. Once we see that someone is positive, the first thing we do is we need to know what is the state of the person's health.
Okay.
We want to check how your liver is doing because the liver does so much for us. It does over 500 daily activities in our bodies, from immune production to clotting factors to sugars. It converts glucose to storage. You know, when we say, oh, insulin production, bile production for fat in order for utilization in the body, it helps convert these glycogen stores back to glucose. It helps detoxify the blood. It converts these toxins, paracetamol, Panadol we take. It converts these toxic drugs into non-toxic substances before they are excreted. It's also in the ministry of excreting in our bodies. It is such a vital organ for such a small space it occupies. So we need to see what is the state in a patient. How is the body coping with the virus? Because we have three broad categories of people when it comes to hepatitis. We have those that go down with the virus. We have those that can actually fight off the infection. And we have
their immune system.
Yes, and we have those that are what we call chronic carriers. They don't get sick, but they infect other people.
Wow.
So we need to know what category of people are you once we notice. And if you are actually ill, then we start, treatment. As we say, hepatitis C is curable, C for cure. Hepatitis C does have a cure, but B is treatable. We can manage you. And like we say, HIV has treatment. There are people who have lived 60 years, 50 years with HIV and have not come down. The same thing would be, there is treatment for you. You can stay and live a normal life without, coming down with the big complications.
So which one of them is the one that that at this point this person is going down?
Most of the time, hepatitis C, it presents late.
If presented late.
Very late. In fact, most people don't notice until their liver is around 15 to 20% effectiveness.
Wow. Okay, let's look at the statistics now, of the infection in Nigeria. How would you rate it? Is it going high or, so let's...
The 2022 analysis that the World Health actually presented is showing that we are having more new infections. We're having less new infections, but less new infections, but weirdly enough, more deaths.
Oh.
Yes. So which is showing two things, is either we are under testing or under treating. So if we're not having enough people to test, our new cases will be low. But if our deaths are going high, it means our treatment is poor.
Yeah.
So
there's no awareness.
Yes. So we need a lot of information to be poured out that hepatitis B is out there and it is around us and it is everywhere. When we say 8 to 12% of the population, it means that For every 100 people, there are 8 people that are sick. That's a lot of human beings that are walking around and are ill.
Okay.
So we need to get that information out there, because the average pepper seller may have heard of it, but does not know about it.
Honestly.
They need to be aware. Even the rich man.
Okay.
People think it's a rich man's disease.
Okay.
They don't understand that it takes more from you, than just your pockets, your time, your energy.
I think, Doc, we need to go on a break.
Yeah.
And when we come back, we'll begin to talk about prevention. Now we've talked about sensitization. We'll still continue on that. All right, we've been discussing hepatitis, prevention, awareness, and treatment. Okay, I will be doing that with Dr. Gift Agbohimen. I hope I'm right. We're going on a break, and when we come back, we'll look at a lot. Sensitization, prevention. We'll look at it when we come back. Please don't go anywhere. Welcome back. Yes, Dr. Gift is still in the house. So let's continue the discussion. So desensitization, awareness.
Yes.
That's what we're looking at. So how aware or how sensitized are people that they need to come for checkup?
Yes.
Okay, they need to come for treatment.
Yes.
So do you think we have enough?
No, we don't.
Okay.
At my office, because I am the medical advisor of Covenant Foundation Schools and the co-founder of Star Foundations, where hepatitis B or hepatitis is something that is our burden. We were able to, on the 28th, in commemoration of the World Hepatitis Day, which was the 29th, able to have an awareness for the local government district. And we had free screenings for hepatitis B and hepatitis C for the community. And a lot of people were surprised about the information we were passing.
Wow.
And were surprised to know that there were screenings that were readily available. We would like, people out there, we know it's expensive. It's not something that the government has taken upon its shoulders, as we have free HIV screenings and all that. We want them to realize that it's their health. They should go out there. You're supposed to be screened every 6 to 12 months. They should go out there and get screened. Once negative is not always negative. Walk into any primary healthcare facility, walk into any hospital. There are a lot of outreaches. Take advantage of these outreaches.
Okay.
We are hoping to go into other districts. We are hoping to come to Durumi sometime this year to also do the same. Get screened. We're happy that we're able to screen almost 200 people in that vicinity. Yes, on Saturday. So get screened. Bodies are there to help. We also want to appeal to the government. The way they pour in efforts on other viruses, they should also put in that same power behind hepatitis.
Okay, I think as we round off, I want you to talk to people and say, tell them the symptoms so that when they notice these symptoms, that'll be your final word. When you notice these symptoms, you should go and see your doctor. So please tell them briefly the symptoms.
Once you notice you're feeling tired and weak, you're noticing your urine change color, you're noticing your eyes getting yellow, your skin getting itchy, your body just feeling uneasy, easily fatigued, having vomitings in the morning, abdominal pain, your tummy swelling, your legs swelling, please get to see a doctor. There is cure, there is treatment. There are people out there researching day and night in order to bring better treatments to you. There is vaccines available. Vaccines are available at a small price. Please, not only for children, but also for adults. Take your health in your hands. Take the information necessary. Be armed and win the fight against hepatitis. As we said, it is time for the nation to take action.
Wow.
Thank you.
Thank you so much. Thank you so much. I'm borrowing her words, It's not a death sentence. It's time for you to take action and remember that your health is in your hands. All right, this is Good Morning Abuja. We'll go on a break, and when we come back, the program continues. Please don't go anywhere.